Good evening, everyone. My name is Kristin Amato. I will be discussing the treatments of specific phobias with specific focus on systematic desensitization, flooding, and modeling. Now, before I get into the actual treatments, I will be doing a little bit of background on what a phobia is. A phobia is a persistent or irrational fear of a certain situation or object. It does remain quite reasonable for the person that fears it, but it does make the person feel very compelled to avoid the situation that they are fearful of. Unfortunately, phobias are very complex, so that is only the start of it. But phobias can interfere with a person's ability to work, to socialize, and to live their everyday life. People who have phobias are often overwhelmed by their anxiety, and they tend to avoid most situations that have anything to do with what they're afraid of. Those people are also stripped from the simple pleasures of life, which can affect them very much so throughout years, throughout their entire life. Now, there are different types of phobias. As I went over, it does affect everyday living. There are over 350 types of phobias, which most people do not know about. Some of the most well-known phobias are acrophobia, which is the fear of heights, claustrophobia, which is the fear of tight spaces, and arachnophobia, which is the fear of spiders. Now I will discuss the symptoms that most people feel when they are dealing or thinking of the certain phobia that they're afraid of. Most people do have instant reactions, and they tend to not control them because they do not have control over it. It does affect a person's mind, and it tends to take over their thought process. Some emotions that they include are dread, horror, and panic, and sometimes they do trigger immediate panic attacks. Now, some causes of phobias are environmental and genetic. Some people do think you are born with a phobia. I tend to think it's more environmental. Anxiety disorders tend to put you at higher risk for obtaining a phobia. Life-scarring events do have a huge impact in gaining a phobia. For example, if you are in a situation where you almost drown and you develop a phobia of the ocean or phobia of water, that could just be from one time. And last but not least, substance abuse and depression are also huge factors in obtaining a phobia. The next topic I will discuss are the three classes of phobias. There is agoraphobia, there is social phobia, and there are specific phobias, which include situational, fear of natural environment, blood injection injury, and animal phobia. Now, agoraphobia, most people refer to it as the fear of open spaces. Most people who have this phobia tend to be afraid of being in large crowds and tend to feel trapped outside of their home. They do tend to avoid most social situations and are known to be homebodies altogether. Now, people who obtain a social phobia, most people refer to it as the social anxiety disorder. Dealing with social situations can lead to self-isolation in this situation. A social phobia can actually be so severe that a simple interaction, as in a hello or opening the door for someone or answering a phone call, can cause an instant panic attack. Those with social phobia often go out of their way to be avoided in most public situations and most social interactions. There are different types of treatments that I will now focus on that do help with phobias. There are many treatments that are unsuccessful, but these three in particular tend to be most successful. Systematic desensitization, flooding and modeling. Systematic desensitization, it tends to be behavioral. In that case, it tends to use a relaxation training and relax the muscles in which you're feeling so tense from due to the fear of the object or the situation that a person's in. For this treatment, the therapist will teach the person that is feared how to bring on deep relaxation in the muscles so that when they confront their fears directly, the fear and the tense that is built up in their muscles will no longer be there from the longer the exposure. An example of this would be if somebody were to be afraid of the dark. The patient would first imagine facing the dark alone. They wouldn't actually be situated in the dark at first. As they tend to picture the thought of being in the dark, the therapist tends to notice if the muscle relaxation is working. And each session that they work on, they tend to focus more and more on if the fear is going away or if the tense muscles are, getting less tense. And the therapist tends to have the patient actually face the darkness at the very last step, which means that the actual systematic desensitization is successful. The three main parts in this specific treatment is that you train the patient to physically relax. You must establish an anxiety order with the actual object that they fear and make sure that it's involved. And then you have the patient fear the stimuli at first, and then as the time goes on, each session, they get used to the fact that it's not so fearful and that the muscles are less tense. And the more exposure they have to it, they tend to get less fearful of it. You continue the cycle until the treatment is successful. Excuse me. Now, flooding is where the therapist exposes their patients repeatedly to the feared object or situation. Excuse me. And due to that overexposure, the person is led to see that the object or situation is harmless. I believe, in my opinion, that this isn't the best treatment for some people because it does tend to overwhelm them. Overexposure to a fearful situation can make them more fearful in some situations. For example, if someone has acrophobia, which is the fear of heights, you would have them jump off a tall building. Or another example would be someone who has arachnophobia, which is the fear of spiders. You would have them touch a spider for 10 seconds. The overexposure of the actual object and the person who is fearing that object could be successful in some situations, but it could be an overload and it could backtrack a person that is trying to find a successful treatment. This treatment eventually allows the person to ease the fear they feel towards a certain item until it vanishes. Excuse me. Last but not least, the final treatment that I will discuss is modeling. Modeling is a process where a person observes, then imitates others, which are based on the same principle as the monkey see, monkey do. For this concept, a therapist would first approach the said feared object, lead an example where the feared object is not fearful, and then The person that is fearful and obtains that phobia will say, touch a picture of the fearful object. And then the next session will be in the same room as the fearful object. Or a next session, they will touch the fearful object. It tends to be you watch, you do. If you see the therapist and he's not harmed by that object, then the person who has the phobia will also see that they might not be harmed by the actual object. For example, for someone who has cynophobia, which is the fear of dogs, a therapist could go pet a dog to show there's no fear needed or the dog is not harmful. And then it tends to lead to a situation where, after much exposure to calm and non-threatening situations involving that dog or any dog in particular, the person who obtains the phobia will realize the dog is nothing to be afraid of. It just happens to be the watch me, do you kind of concept, which is the monkey see, monkey do. This tends to be a very successful treatment due to the fact that you're watching somebody else not fear, so you might not want to fear as well. If you see somebody doing something, you follow their actions, which is basically the entire objective of the modeling treatment, which, as I said, is very successful for most people. In conclusion, the 3 treatments that I've discussed are systematic desensitization, we have modeling, and we also have flooding. These 3 treatments in particular, they are very successful. In my opinion, I do believe modeling is the most successful, but in most cases, everybody's different. So these treatments apply to who they need to. I hope you enjoyed my presentation on the specific types of treatments that can be used for specific phobias. Thank you.